some weeks ago, I already mentioned 3 key points in the control of COVID-19. All right. Number one, you need to test, and then for real, cases must be isolated in good facilities. It must be really isolated. Number two, then you do good contact tracing. And those who are contact has to be really quarantined. It must be real, all right? And they must be quarantined in facilities such that these people are set aside from the rest of the population. Now, this was done in Hong Kong for months. And then in the hospital, as I mentioned, point number 3 is that you have good infection control practices. And in Hong Kong, we have the privilege of 203, and our public hospitals and private hospitals are ready. And in fact, up to today, even with the recent surge, we still do not have a proven or definite case of hospital staff, both in the public and private hospital, getting infected. It's because of good infection control practices. So 1, test and real isolation. Number 2, contact tracing and real quarantine and good infection control practices. Now, why is the reason for the recent surge? It's because of some loopholes. Nobody's perfect. And the loopholes in Hong Kong, for instance, we have the maritime workers, the exempted airline staff who were not tested. Now, another concern I have is that when you start having home quarantine, and I really would plead that these can have their dangers, or home care. In fact, in the WHO discussion group or expert group, we did mention that home care is something you may not want to put in the front. It's only when you have no other choice. Because with home care and with home quarantine, there's always a chance that people do not comply, and then you have these things that spread. So I think the big reason why for the recent surge in many countries, including Hong Kong, is these loopholes. Now, governments, including Hong Kong, have done a lot very actively to cover these loopholes. And to their credit, but I really would put forward this home quarantine or home care to be very careful, because they are very, very difficult to control, and you must really put great effort to do that. Thank you.
Right. Are you saying that the onus should be more on individuals? People should be more socially distant. People should wear masks. Do these measures, in fact, work successfully?
Yes, it helps. It definitely helps if you social distance. But if you don't do that first, the 3 elements I mentioned, then you would have loopholes. And it's like a bag. You know, you have a bag that contains everything, but do understand that for COVID-19, it's like this bag, it does holds everything, but when you have holes, it will start leaking, and before you know it, it wet the whole table. So as you begin to do all this distancing and so on, which is very positive, don't forget the 3 elements I mentioned. It must be. If there are loopholes, you will find that it will even sort of null the effect of all this social distancing and so on. You see? So do put attention to those 3 elements I mentioned.